For over 11 years, Dr. Kristy Allen Harvell, D.C., has been a revolutionary force in the world of chiropractic care and wellness. Her dedication and passion have led to an extensive repertoire of knowledge and skills that have radically and consistently transformed the lives of countless individuals.
I love Dr. Kristy's approach. She looks at things from a whole system point of view. When I first came to her, the way she described what she did was about getting my body as well as it could be so it could fix itself, rather than giving me something to fix particular symptoms. So it was a whole system approach, and that really appealed to me because what I was experiencing was a whole system issue. I was diagnosed with chronic fatigue syndrome 10 years ago, and I had not had much luck with any doctors. I tried quite a few different alternative medicine routes and kind of given up. But I had a friend recommend Dr. Kristy and decided to give it a go, not with not so much expectation. I've had adjustments and nutrition testing with accompanied supplements. And at the beginning, I did quite a lot of detox things, including the foot baths, which I found really helpful. I gained a new sense of confidence in my body, that if I respected it and allowed it to do what it could do to help heal me, then it would do that.
From your first visit, she instills trust in her and you, and she will take the time, and she takes more time than more doctors will. She asks excellent questions. She listens, first of all. She actually takes extremely good notes, and at your second and third visit, she refers back to those notes, and she will explain and tell you step by step what's going on with you and how you're going to fix you, and then you'd be surprised how quickly you see the results, and you won't leave there until you're feeling better. And she'll actually even tell you, send you home with homework. I want you to do these stretches. I want you to do this. Call me tomorrow. Let me know how it made out. She has a definite care in her patients that a lot of doctors don't. I came to visit or see Dr. Kristy for pain management, lower back problem and neck problems, as well as fibromyalgia. The good thing about Kristy is she offers many different supplements and to explain and tell you, and then she leaves it up to you to decide, what you want to do.
I started seeing Dr. Kristy almost 4 years ago. The first time I was in this office was February 22nd, 2011. I remember that was a very memorable date because on February 24th, 2 days later, I had an adrenal crash. Kristy had accurately diagnosed me with adrenal fatigue 2 days earlier, but I had been ill for so many years and not knowing what was wrong with me that I came to her in the nick of time. She has been a tremendous help to me. Right away, I knew she understood what was wrong with me. I am an RN, so I do have medical knowledge, and I could tell right away that she knew what was wrong with me, and it was so exciting to find someone after so many years to be able to diagnose me. And then the care that she gave was always consistent and caring and so focused, and then there were so many different modalities of treatment that she used that were healing to me. And then to have her being able to see what was going on with me as I progressed through my illness. She used to say, if you don't tell me, I'll tell you. And she did too. She was able to pinpoint what area that needed to be worked on in order to bring me back to health. I learned a lot about my body and true health care from Dr. Kristy. I learned the body as a whole, and in order to heal, you have to treat the whole body. The body has the ability to heal itself, but you got to give it the right things to heal itself.
My name is Jean, and I am a benefit administrator. Own my own company for 32 years. I'm kind of a newbie. It's been about almost 11 years that I have seen Dr. Kristy. I had severe neck pain, which I think was caused more by working on a keyboard more than I ever have. Kristy not only is a friend. I can't do this. I was very leery of going to a chiropractor because of past experience that I had. I think that the issue of listening and not just feeling your bones and maneuvering them is a big part of it. The body is a very intricate thing. I have learned to integrate medical medicine and chiropractic and stretching, exercise, but not rely wholly on the MDs of the world. I believe that through all the years that we have been ingesting chemicals through our foods, that's probably why we're taking as many drugs as we are. I think chiropractic kind of helps you get attuned to your body so that you can talk to it better, you know, not put more medication into it. Anyone who has pain, it doesn't have to be a herniated disc, but who has pain should seek chiropractic help.
Well, now I really don't think I could go to a regular doctor because they don't see the whole picture. I've been seeing Dr. Kristy for 2 years, going on 3. When I first came to see her, I was at the point where I thought I might have to quit my job because I was in such pain from rheumatoid arthritis, fibromyalgia, and anxiety. I feel that the chiropractic treatments do help me with my immune system, so they help keep it stronger. The first thing was diet, exercise, and using supplements instead of over-the-counter medicines. I learned to really trust my own instincts, ask questions, eat healthier, try to get rid of toxins, you know, overall, so you can have just better quality of life.
What she teaches just doesn't end with the person she teaches it to. She teaches it in a way that you want to share the knowledge because she wants to share it so that it's shared and that not just one person's getting helped, but many. And then those people share it. She's unbelievable.
Dr. Kristy, to me, is kind, caring, so intelligent and well-informed, empathetic, and compassionate. I first came to Dr. Kristy about 4 years ago. After seeing her for a while and getting my allergies under control, we started to concentrate on whole body wellness and nutrition. And she has not only worked on great chiropractic problems with me, but especially for me, nutritional wellness. And as I've gotten older, I had hyperthyroid problems, and I am very proud to say that by working with her on wellness and nutrition, we have my cardiac risk factors and my hypothyroid markers all within normal range consistently just by good nutrition and wellness care.
I've been seeing Dr. Kristy for about 6 years, along with my husband and my 2 small children. Originally, I came in to see Dr. Kristy just to maintain my triathlete well-being. So I was training for triathlons, and I really wanted to physically be well enough to continue doing what I love. I really think of Kristy as my wellness counselor. She helps me with so many things in my life. I see her for physical reasons, to take care of my body. I see her to help me with nutritional assessment, making sure that we can go beyond our organic food choices and really maximize what we're putting into our bodies. I see her to help eliminate toxins from our system. My family's, after a vaccination, for example, we will come here. And just overall well-being, really. I tend to come to her for most of my questions about life and how to do better for myself and my family. What Dr. Kristy has taught our family is that the body was meant to take care of itself. So we're built to survive, we're built to thrive, but unless you're willing to be proactive about really setting your body up to perform the way it was meant to perform, it won't be able to do that. So she's helped us to learn how to take care of ourselves so that we can be the best that we can be.
I actually had a referral from a friend of mine who used to work for Dr. Kristy, and I came in here and not only did I get an adjustment, but I got a scan on my back that I hadn't seen in a long time. Doctors do, so she was doing stuff that was different from my other doctors. Basically, I've had numerous problems with my back, my legs, my feet over the past 3 or 4 years, and also coming out of the past. So I've come for regular chiropractic adjustments, but actually I'm getting a lot of problems fixed that nobody else could fix. And it took several months of going to doctors and finding wrong results from them before Dr. Kristy asked me, well, you had your surgery 2 months ago. You've still got knee pain. What kind of medications are you taking? And I said Vytorin. She said, that's it. That is the cause of the knee pain, and she was right, because I stopped taking it, and immediately after that, the pain went away overnight. And I waited a few days, took the medication again, and lo and behold, the pain came back. So I knew it was that. So she discovered that, for one thing. She's kept my back in line. She's helped me with my legs and my feet. I've had problems with my feet caused from bad arch supports. I had 3 different arch supports put in. None of them worked. I had a lump on the bottom of my foot that was 1 inch high, close to 1 inch high, that was causing the arch supports not to work. And when I saw her, I'd come out and I could actually walk. While I was suffering from my knee injury, I had gone to a doctor at another clinic that was for veins because they thought it might be leg vein related. And they said, oh yes, your pains in your knees are being caused by your leg veins, and we're going to strip out all the veins in your legs so that you can, be better. Well, it basically boiled down to me telling them, no, you're not, because I had no logical explanation from them as to why. And I wasn't going to go through an operation for no reason at all. And I'm glad I didn't, because that just wasn't the problem. The biggest problem I had started about 3 or 4 years ago when I had to see a knee surgeon because I had bone-on-bone arthritis in both of my knees. And he said I needed both of my knees replaced. But you gotta lose 50 pounds before you do that. And I knew that wasn't gonna be easy, and it goes off very slowly. But when I was seeing Dr. Kristy, she had me on glucosamine supplements, and I did some other research and found out by seeing a physical therapist and finding out the right exercises to do, and by seeing Dr. Kristy, having regular visits to the chiropractor, that by the next year, I didn't need shots in my knees. When they offered them to me, I said, no, they seem to be doing better. And the doctor was scratching his head. He had no clue why, because he saw in the x-rays it was bone on bone. And that year it also measured bone on bone, but I wasn't having the pain. The 3rd year of going through these glucosamine supplements, I went there and the doctor was so shocked. He said, there's space between your kneecap and the bone. He said the x-rays must have been wrong. Well, I know the x-rays weren't wrong because I'm the one that had the arthritis knee pain. The x-rays were correct, and it was getting better by taking the glucosamine and doing the physical therapy exercises that I've been doing for 3 years.
in nurses training when I did, Western medicine just focuses on the problem at hand or pinpoints a problem and focuses on that, where Dr. Kristy would figure out what major part of your body was causing you to have ill health or keeping you from getting better, and treat that. It may not even be my adrenal glands. It may have been something else that needed to be strengthened in order for my whole body to heal. There were some lifestyle changes that I had to make, and being able to come to this office and to learn them was a great privilege. She taught me the proper eating of carbs and fats and proteins, and which I didn't really understand fully. So she taught me dietary changes. She taught me how to handle stress, and also the importance of keeping my body healthy as a whole. The importance of the chiropractic care, having my body in good alignment. There were many things in the last almost 4 years that I've learned here. I would recommend everybody, and I do recommend everybody, to come to Dr. Allen and to get even if they're feeling well, just for the preventive health and the understanding of how the body works. And I've had friends come here. One friend in particular who had leukemia, and the doctors said that they had done all they could for her, and she came here, and that was, I think, close to 5 years ago, and she's doing great. It really turned her around, and so grateful. And so I've seen a lot of people come here and be extremely helped.
So since Joseph came into the world, he has also been adjusted by Kristy. I was so confident in what she could do that I decided that it would not do any harm and probably be quite helpful for him to have some adjustments. And I believe it has helped with some reflux that he had, and I gotta say, he loves it. He really loves it. So I do it sometimes just because he enjoys it so much.